Hello, we are back with another episode of Health Matters, this time to talk about diabetes. With us today is Dr. Marina Vaz, Assistant Professor in the Department of Medicine at the Goa Medical College. Dr. Marina, thank you very much for taking the time off your schedule to educate us on diabetes. Before we get into details of the disease and the way it affects lives, could you tell us what is diabetes?
So diabetes, as we commonly know, is a condition which is associated with raised blood sugar or glucose levels, which we call hyperglycemia. Now the problem with diabetes is not just the raised blood sugar, but the problem that this blood sugar causes. So what happens in diabetes is that it starts affecting the blood vessels, the arteries. It causes changes in the blood vessels, and it affects two types of arteries. The larger arteries, causing a condition called macrovascular disease, large vessel. And the smaller arteries, causing a condition called microvascular or small vessel disease. Now when it affects the larger arteries, it affects three main organs. It affects the heart, giving rise to what we normally call heart attacks. It affects the brain, giving rise to strokes. And it affects the blood vessels of the limbs. And thereby giving rise to gangrene, which eventually leads to amputation of toes or of the entire limb, part or entire limb. When it affects the smaller arteries, it starts affecting the eye, and in the eye it affects the retina, which causes visual disturbances and eventually leads to blindness. The second small vessels that it affects are in the kidneys. So eventually it gives rise to a lot of kidney disorders and renal failure. And the third small vessel is the vessels which supply the nerves, which are present in the limbs, upper and lower limbs, whereby it causes loss of sensations, which eventually gives rise to a lot of non-healing ulcers, wounds, and complications thereby. Besides that, diabetes affects many other organs like the liver, giving rise to chronic liver disease and cirrhosis. So from this, you'll be able to make out that diabetes affects almost every organ in the body.
That's what it's sounding like. So before we go further to understand more about, prevention or the various other things related to medication and treatment, just to understand the magnitude of incidence, statistically speaking, what is the global burden of diabetes?
So according to the WHO, that is the World Health Organization, the global burden or the prevalence of diabetes, according to the latest study, is about 8.7%, which means that 8.7% of the entire population is diabetic. Now what is more interesting to know is that over the past 30 to 35 years, this number has doubled. So diabetes is on the rise, and it is rising rapidly. Besides that, we should know that diabetes is the leading cause of death due to cardiovascular disease, heart disease.
Interesting.
It is the second most common cause of stroke. It is almost the commonest cause of renal failure, that is kidney failure. It is the fifth leading cause of blindness as estimated by the World Health Organization. And more important than that, it is one of the most important cause of preventable blindness, which can be prevented. And it is an important cause of amputation and loss of part or whole of limb, which eventually leads to loss of productivity. And it is estimated that by the year 2030, diabetes will be the seventh leading cause of death worldwide. So this is the global burden that diabetes poses.
Is there a significant difference in those statistics in the Indian context?
It is not very different, because the Indian population, although it has a rural and an urban, there's a difference between the two. It is found that diabetes recently is almost the same in both populations, the incidence and prevalence of diabetes.
That's interesting. So therefore demographic may or may not
play a role.
We know that there are different types of diabetes. Can you tell viewers about the kinds?
So broadly, diabetes can be classified into two main groups. There is type 1 diabetes, which commonly affects children and adolescents. In this condition, the pancreas, which normally produces insulin, which controls the blood sugar levels, is damaged for some reason. And since the pancreas is damaged, there is no insulin production. So these patients are insulin deficient.
Right.
So this type of diabetes, type 1 diabetes, is called the insulin dependent diabetes mellitus.
Okay.
And these patients are usually lean and very thin. Now you have the second type of diabetics. Type 1 diabetes accounts for only 5% of the entire diabetic population.
Okay.
Okay. The second type of diabetics, also called type 2 diabetics, make up the larger 95% of the diabetic population.
Okay.
Now these are the diabetics which we commonly see in adults. They are usually obese, have a sedentary lifestyle, and in this condition the pancreas is normal. It produces insulin, but the insulin either might not be secreted properly, or more commonly it is not utilized in the body well.
Okay.
Okay, so since insulin cannot act well on the body, this is called type 2 or insulin resistant diabetes mellitus.
Okay.
Now, this is how diabetes is broadly classified.
Okay. I've heard about juvenile diabetes. Could you talk a little bit more about it?
Juvenile diabetes is the same as type 1 diabetes, the one which affects the children, the
Okay.
younger
Okay.
population.
Okay. And does that carry through into adulthood, or is
Yes.
there a high incidence of?
It is type 1 is mostly seen in children,
Okay.
and since it is a chronic disease, it continues
Carries
into
forward
adulthood.
into
Yeah.
life. Okay. Is there a particular age at which diabetes affects? I know you said type 1, the incidence is only about 5%, which
Right.
is children and adolescents. So therefore, is there a significant bent towards getting the disease in adulthood or later stages in life, etc.?
Yeah, so the more common form, which is type 2, usually occurs after 40 years of age
Okay.
in adults. Now, there are some situations where it might occur earlier, that is
Okay.
even below 40. That happens when there is a family history of diabetes, because diabetes runs in families. So if you have a parent or a sibling who is diabetic, then there is a chance that you might have it before 40 years of age. It is also seen to occur earlier in individuals who are obese
Okay.
or who have had childhood obesity.
Okay.
So if you have been overweight and obese since childhood, these are the persons who might get it even before 40 or even before 30.
Okay. Okay. So you've just mentioned obesity, you've talked about a sedentary lifestyle, you've talked about heredity. Apart from these, are there other profiles of people who might be at risk of developing diabetes?
Right. So diabetes is a lifestyle disease.
Right.
So the ones who are at highest risk are those who have a sedentary lifestyle, who are physically inactive,
Yeah.
a sitting job most of the time.
Yeah.
Those who are obese or overweight, persons who have other lifestyle diseases like
Okay.
hypertension,
Right.
hypercholesterolemia, that is high blood pressure and high blood cholesterol. So they are at a higher chance of having diabetes also.
Okay.
Then persons who have had a positive family history, like I told you earlier,
Right.
parent or sibling having diabetes. Women who have had gestational diabetes, which is diabetes which develops during pregnancy,
Okay.
this diabetes might disappear. So the blood sugars might come to normal once delivery happens. But these women are at a 40% chance of higher risk of developing diabetes within the next 10 years.
Okay.
Okay, of developing chronic diabetes.
Right.
So they are also a population which are at risk of developing diabetes.
Okay.
And then there are some other syndromes like polycystic ovarian disease,
Yeah.
which is commonly associated with irregular menses and infertility. These individuals are also at a risk of developing diabetes.
Okay. So what are the symptoms of diabetes?
Good question. So type 1 diabetics, I say normally, are the lucky diabetics,
Okay.
because they are the ones who present with symptoms. And the symptoms in these patients are polyuria. By polyuria, I mean the tendency to pass urine frequently and pass large amounts of urine. They also have something called polydipsia. So polydipsia is a condition where the patient feels like drinking water repeatedly, large amounts of water, and they have extreme thirst. So these three symptoms prompt the patient to go to a doctor and look out for what's happening, and then eventually the blood tests are done and they are diagnosed to have diabetes.
Okay.
Sometimes in the presence of infection, these patients type 1 diabetics get a complication called diabetic ketoacidosis, where the blood sugars go extremely high, and then they have symptoms like vomiting and severe abdominal pain, need to be admitted, and that's how diabetes might be diagnosed.
Okay.
Now coming to type 2 diabetes, which is the more common form, these are the unlucky diabetics.
Okay.
Because in these patients, diabetes has no symptoms most of the time. So it is asymptomatic.
Okay.
Broadly, diabetes is asymptomatic. Now, how do these patients present? They are usually diagnosed to have diabetes on routine screening. So you go for a blood test and you do your profile and you see that your blood sugars are high. Or it is diagnosed in the presence of some other disease. So you're admitted for something else and then you're diagnosed to have diabetes. But most commonly, they present with complications of diabetes, like they present for the first time with a stroke or a heart attack or renal failure or a gangrene of a limb, infection, ulcers, and that is when they are diagnosed to have diabetes. So, generally speaking, diabetes is asymptomatic, doesn't have any symptoms of its own.
Okay, so there is nothing that would set off a red flag to a potential patient, which would then motivate them to go and check if
No.
they have or
Right.
don't have. Okay, which isn't really the safest,
Right.
right? Okay. So what is
So
the
you should not wait to look for symptoms to get yourself checked for diabetes.
Which means one does what, regular blood screening?
Yes, so patients often ask the question as to how would I know that I am
Correct.
diabetic? So the only way that you can know that you're diabetic is to screen for diabetes or to get
Okay.
yourself checked for diabetes.
Okay,
Now, what would be a right age to
start.
So since I told you the population at risk is the population above 40, so that population is the one which should screen for diabetes. It should be done frequently, every 6 months at least.
Okay,
Okay, and in populations who are at higher risk, like those who have positive family history or who are obese, they should be checking themselves even earlier, so maybe after 30 years of age.
okay,
Okay,
okay.
or someone who's got other complications like heart attacks at early age or strokes in the families at a younger age. So these are the ones which should have themselves screened earlier.
Okay, okay. And that would be via a complete blood profile?
Yes. So the profile that you should do to check yourself for diabetes is a fasting blood sugar level, which
Okay.
should be less than 110 milligrams per deciliter. A postprandial
Okay,
blood sugar level, which is done 2 hours after meals,
Okay.
which should be less than 140 milligrams per deciliter.
okay,
And an average blood sugar, which we call the glycosylated hemoglobin,
okay.
which should be less than 6.5%. So
Okay.
these are the tests that should be regularly done.
What is the treatment for diabetes?
Yeah, so as I told you, diabetes is a lifestyle disease. So the main treatment to control diabetes is to modify your lifestyle.
Okay,
Adopt a good lifestyle right from the start. So what do you mean from the start? From the start, I mean right from childhood.
Okay.
So see that your children adopt a healthy lifestyle, regular exercise, good dietary habits. Avoid smoking, alcohol.
okay,
Okay. So these are the lifestyle changes that you would want to do. Besides that, there is medication which helps insulin to act on the body. So it removes that insulin resistance which is there.
Okay.
And but these drugs aid in the control of diabetes along with a change in lifestyle. And if there is no change in lifestyle, then medication is useless, almost useless.
okay. Now you just talked about medication impacting insulin. Was it absorption?
Action.
Action.
Yeah.
So do all patients with diabetes need insulin? How does the medication work?
Okay, so type 1 diabetics, like I told you, are insulin deficient.
Yes.
They don't have insulin because the pancreas is not functioning.
Right.
So they necessarily need insulin.
Okay.
As long as they are on insulin, diabetes is controlled, complications are prevented. And they need to take insulin lifelong.
Okay.
Now, type 2 diabetics, since they are insulin resistant, insulin doesn't act well, they are normally started on tablets,
Okay.
oral medication, which helps insulin to be secreted properly and to act well on the body. After some time, type 2 diabetics eventually become insulin deficient. That usually happens after 10 to 15 or even sometimes 20 years after the onset of diabetes.
Okay.
So at that point, the pancreas completely runs out of insulin and the oral medication doesn't work anymore. That is when you'll notice that the blood sugars which initially used to get controlled now don't get controlled anymore with your medication.
Okay.
So that is the time the type 2 diabetics need to be instituted on insulin,
Okay.
okay, and then it will need to be continued.
So it sounds like regardless of whether it's the case of type 1 or type 2, treatment is a lifelong companion?
Yes. Diabetes is a disease which cannot be cured, but if treated well, it can be controlled.
Okay.
And that is the only way to prevent complications.
Okay. Do people hesitate to start on insulin, maybe thinking that the reality is that once you start medication, regardless of whether it's type 1 or type 2, you will be on treatment lifelong?
Right.
But is there a greater resistance or hesitation towards starting to be on insulin in particular?
Yes. A lot of people are hesitant to start insulin especially, thinking that once it is started, it cannot be stopped. But the truth is not that it cannot be stopped. The truth is that it should not be stopped, because diabetes is not going away. Once it sets in, it's going to be there. It's going to be lifelong. So the only way that you can control it is with treatment. And insulin is usually initiated either when the patient is not getting well controlled, or if the patient has got some acute conditions like an infection or cardiovascular diseases.
Okay.
And then it is instituted. So if the case is that diabetic medications are not helping anymore and insulin is started, then insulin has to be continued lifelong.
Okay. Are there precautions to be taken when taking insulin?
Yeah. So often patients complain of pain at the site of taking insulin. Now this happens because patients usually inject insulin at the same site every day.
Okay.
So what happens when you inject it frequently at the same site is that the skin develops some changes, and that gives rise to pain, because of which patient stops taking insulin, and then the blood sugars don't get controlled. Now normally insulin is given in 3 shots of a short acting insulin before meals and 1 shot of a long acting insulin at night.
Okay.
So it is a good habit to give insulin at different sites. So what we do is we normally divide the abdomen into 3 quadrants, the
Okay.
upper, the middle and the lower.
Okay.
So you give the morning dose in the upper quadrant, the afternoon dose in the middle section, and the evening dose in the lower part of the abdomen. And the night dose, if you are taking one more, is to be taken on the thigh.
Okay.
Then you alternate sides. So one day taken on the right side, one day on the left side. So when you do this, you're not giving insulin at the same site every day, so you're preventing all the skin changes and pain, etc. And if there are skin changes and you're giving it at that site, insulin doesn't get absorbed well.
Okay.
The second thing that you should remember is that insulin is injected into the fat below the skin and not directly into the skin.
Okay.
So while injecting insulin, like the doctor usually tells the patient, that you are supposed to make a fold of the skin and inject the insulin at the base of the fold, so that it enters into the fat and not into
Okay.
the skin.
Okay.
And select a site where the body fat is more, like the abdomen or the thigh.
Right.
Avoid giving it on the arm, because the amount of fat in the arm is very less.
Okay.
And if you inject it there, it doesn't get absorbed well. So then the blood sugars don't get controlled well.
Okay. Okay.
Another thing to remember is timing between insulin and meals. So
Okay.
the regular insulin which is given usually takes about 20 minutes to half an hour to act on the food that we consume. So insulin should be taken about 20 minutes to half an hour before meals. If it's
Okay.
taken a long time before, like 1 hour before, or immediately before, like 5 to 10 minutes before, it will not act on the meals. So then the sugars don't get controlled well, and patient might get other complications.
Okay. Dr. Marina, you talked about diet and dietary control when you were talking about starting that from childhood itself. So can you elaborate a little bit more about diet in general?
Yeah. So when we talk to diabetics, we usually tell them to restrict themselves to 3 main meals per day.
Okay.
So breakfast, and then lunch, maybe a small cup of tea without sugar in the evening, and an early dinner. Avoid snacking in between meals. So when you snack in between meals, what happens is, even though your fasting sugar and your postprandial sugar might be normal, the average blood sugar is always on the high. And that is the one which eventually leads to complications.
Okay.
The second thing is to have a good diabetic diet plate. So you divide your plate into 4 parts. Have rice in one part, brown bread or chapati in one, good amount of vegetable in one, and protein in 1/4. Okay, it is important to include a lot of vegetables and fiber in your diet.
Okay.
So have a good amount of salad before lunch and before dinner. Now what the salad does is it causes some amount of fullness, so you don't overeat.
Right.
And the fiber in the salad prevents the glucose from the food from getting absorbed.
Okay.
At night, it is preferably advised to avoid rice. Okay, and instead of rice, you have either brown bread or chapatis at night.
Okay.
You can have fruits. The fruits which are normally included are the ones which have good amount of fiber, like apples, papayas, pears.
Okay.
Okay, avoid fruits that are too sweet, like bananas, mangoes.
Okay.
Okay.
Okay. You just mentioned that rice is permissible at one meal, and very often we hear people who are diabetics say no rice at all. So, rice is actually
Yes.
acceptable?
You can have some amount of rice,
Okay.
not like the heaped rice that
One would otherwise normally
right.
have.
Okay, so we usually restrict to 1 vati of rice, which
Okay.
becomes about 1/4 of a plate.
Okay. Given that this is Goa, is alcohol permissible at all in diabetic patients, or is there a permissible limit around intake?
So alcohol, what it does is it gives empty calories. Okay, so by empty calories we mean that it doesn't give any nutritional intake, there is only calorie, and alcohol affects the liver. It gives rise to progressive liver disease. Diabetes by itself also affects the liver and gives rise to conditions called fatty liver and eventual cirrhosis. So when both factors are present at the same time in the same patient, liver disease progresses faster.
Okay.
Okay, that is one thing. Secondly, in a place like Goa where alcohol is freely available in large amounts, there is no limit to the word limit. Okay, and occasions don't happen occasionally. So there is no fixed amount or limit of alcohol that I would advise to patients, and I would advise them to avoid it as much as possible.
Okay. How often should a patient follow up with the doctor?
Yeah, so sometimes it is seen that patients are started on medication and they continue the medication faithfully, but forget to meet the doctor. And they don't follow up because they don't seem to have any problems or any symptoms or any other side effects. But the reason you need to follow up with the doctor is that the doctor needs to check your blood sugar regularly and see if it is getting controlled with the medication that you're on. And if it is not getting controlled, then the medication might either need to be stepped up or changed. Secondly, the doctor will have to look at other lifestyle diseases that might be developing, like hypertension or raised blood cholesterol levels, which need to be treated simultaneously. And the third important thing is that the doctor will look for other complications of diabetes which might be setting in and which will not give you symptoms initially.
Okay.
Okay, like renal involvement or retinal involvement. So all those things will be looked in by the doctor, and that is why you need to follow up regularly, at least 3 to 6 monthly.
Okay. Now, I'm going to pick on something that you mentioned related to the complications. So, my question actually relates to prevention. Prevention on two fronts. One, diabetes itself, and the second, complications arising from diabetes.
Yeah. So, how can diabetes be prevented? Can it be prevented?
Can it be, or
Yeah.
and if it can, then how?
Since diabetes is purely a lifestyle disease, it can be prevented by adopting a good lifestyle right from the start. Like I said earlier,
Yes.
right from childhood.
Yes.
So encourage your child to adopt good health, good eating habits.
Okay.
Eating more of home food and less of outside food.
Okay.
Less of oily food. Okay. Encourage children to play outdoors more than indoors. Okay. So when that happens from childhood, you're maintaining a fit attitude which will grow into adulthood.
Okay.
Okay. As adults, maintain an exercise routine daily. At least half an hour to 1 hour of a brisk walk every day.
Okay.
Okay. That is what will maintain you, help you to be fit.
Okay.
Okay. And avoid smoking, avoid alcohol.
Okay.
Okay. So this is how diabetes can be prevented, by
Okay.
maintaining a good lifestyle. Now coming to complications. The only way complications can be prevented is by diagnosing diabetes early and treating it. So maintaining strict compliance with your diet, with your lifestyle and with your treatment. Because as long as diabetes is controlled, you can prevent or at least delay complications. The second thing is go to your doctor frequently, who will check and look for complications arising at the earliest. Now one of the important complications is visual disturbance, as I told you, which eventually leads to blindness.
Yes.
And blindness in diabetes can be prevented. Okay. Diabetes affects the retina. So what is done is something called a fundus examination, where you look for the blood vessels in the retina, and this is to be done at the onset of diabetes. So the first time you're diagnosed to have diabetes, you are supposed to have a fundus examination done, because diabetes, as I told you, sets in even before you have checked.
Right.
And after that, the fundus test has to be done every yearly. So the eyes have to be examined every yearly, and at the earliest sign of any disease, the patient has to be referred to an ophthalmologist who will advise treatment. And treatment for eye disease has to be done even before the patient has symptoms of visual disturbances. Because by the time vision gets affected, it is usually too late. Okay? So that is about eye disease. To prevent heart disease, the patient needs to undergo tests like an electrocardiogram, a treadmill test, which is usually done yearly. So you pick up disease at the earliest. Okay? Kidney disease can be prevented by doing blood and urine tests frequently and looking for any signs at the earliest. Now another important complication is the peripheral vascular disease, which I told you, like diabetes causes gangrene and ulcers. Now this is because of two facts. One is that the patient doesn't have good sensation on the feet, because of which they are not able to appreciate minor traumas and wounds. Okay? And the second problem is there is no good supply to the limb, blood supply, because the arteries get affected. So healing doesn't occur well. So what we advise the patient is to wear comfortable shoes, closed shoes, so that the patient doesn't get wounds and injured and trauma easily, and avoid walking bare feet. And it is a good habit for diabetic patients to inspect their feet at night every day before going to bed, so that you will see any wound or any thorn prick or any callosity or corn at the earliest. And at the earliest sign, you should meet your doctor, avoid any local treatments and remedies, so that it can be treated at the earliest. Because by the time a diabetic usually notices a wound, it is too late. Okay.
You just touched upon local treatments and remedies. Are there any that are prevalent in the space of diabetes, and are they advisable or not?
So local remedies may be helpful in some way. I'm not the best person to elaborate on it, but I would say they should not be replaced for medication. Okay, so there are some herbal medications that a lot of patients take. We don't have authentic information on that. Some of it might be harmful, but in any case, it should not replace your regular diabetic medication.
Okay. Where can one go to find information about the disease? Are there centers, counseling centers, or are there websites that somebody can use for reference? Because doctors often advise patients not to go to Google. There's a lot of information out there, and I think for the lay person, it's difficult to know what is right and what is not right, or what is applicable and inapplicable in a particular condition. So are there centers that people can go to?
Yeah, so the problem with online sites and Google is the authenticity of the information that you're using. Okay, so that is why we usually don't advise patients to go there. And the best person to explain diabetes, the complications and the diet, etc., is the doctor. Okay, so follow whatever your doctor tells you. Besides that, there are dietitians and nutritionists which are attached to most hospitals. So you can meet them and ask them, because they are more helpful than online sites in deciding the local foods that a patient should eat. Okay, so that will help you more than some international site or something like
Okay, okay. Do you have any specific advice for our viewers?
So diabetes, as I said, is a lifestyle disease. Once it sets in, it cannot be cured. It can only be prevented. It can be prevented from the start by adopting a good lifestyle, and it can be diagnosed earliest only by screening regularly. Once it sets in, the complications can be prevented only by maintaining a strict compliance to your lifestyle and the medication, and regularly following up with the doctor. So adopt a good lifestyle and stay healthy.
Dr. Marina, thank you very much for that message and for your time today. It's been an interesting interview, a very informative interview.
Thank you for having me on the show. It is a privilege to represent St. Luke's Medical Guild on the show.
Not at all. It's been a pleasure, and we've had a lot of very, very good interviews with doctors from St. Luke's Medical Guild here. And thank you all for watching. We wish you all a healthy lifestyle.